Many voters say health care is their #1 issue. The two men running to be our next governor have very different views on this subject. CBS 2 political reporter Dave Bryan takes a closer look.
How about this clown in California who's running for governor?
At a rally in Las Vegas last month, this clown in California, whom President Trump referred to, is Democratic candidate for governor Gavin Newsom. Why did the President of the United States call Newsom a clown? Because Newsom supports creation of a universal health care plan in California, which he says has already been established in the city of San Francisco. Trump had a field day mocking the plan.
Who's going to pay for this? And do you know how bad it's going to be? It's the craziest thing I've ever heard.
I want individuals to have more of a voice in their own health care at lower costs. And that's why I believe in universal health care. Those that don't are arguing for the status quo.
In a recent interview, I pressed Newsom on the funding for universal health care. Where does it come from?
Last year, according to UCLA, we spent $367.5 billion on health care. It's more than $1 billion a day. Yet millions of people are falling through the cracks. I'd like to look at the existing resources, close to $400 billion that we're already spending, and start targeting and resourcing things in a very different way.
But Loyola Marymount professor Fernando Guerra says the cost alone dictates that it's not going to happen.
Really, it costs a lot of money. It would prevent Governor Newsom, when elected, really from doing anything else but funding this. He would actually have to have cuts on education in other areas. So he's not going to destroy the rest of his legislative agenda by this one issue.
Republican John Cox has a much different approach. He told me all it would take is advertising medical services like fast food hamburgers.
When we have doctors advertising their prices like car dealers or restaurants, we'll have solved the healthcare crisis in this country. You do that by letting the free market operate to have a competitive and quality system, and then you provide opportunities, vouchers for people that are below the poverty level.
Some people would say that's what we had before Obamacare, and it wasn't working very well.
Obamacare is a perfect example of the government trying to control things, and very rarely, if ever, does government do a good job of that.
On this particular issue, Cox seems to agree with President Trump that abolishing the Affordable Care Act is the best way to go, to be replaced by ad campaigns allowing consumers to sign up for cheap medical services and minimal insurance policies until they have a serious injury or illness. That could be a financial disaster for families who take a rock-bottom health care plan and then suffer a serious illness or injury that requires expensive long-term treatment or surgery. Dave Bryan, CBS 2 News.